if a woman isn't aroused, she just gets lubrication and she can continue on if she wants to.
Right.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Welcome to the Sex Doctors, featuring Dr. Marianne Brandon, clinical psychologist and diplomate in sex therapy, and Dr. Abraham Morgentaler, renowned urologist and expert in sexual medicine and testosterone therapy. Together, they bring you expert insights into sex, intimacy, and relationships. Let's dive in.
I believe in miracles. Where from? Hello, Dr. Brandon.
Hello, Dr. Morgentaler.
Great to see you again for another podcast.
And it's great to see you too.
So listen, I thought we might talk today about Viagra and Cialis and the class of medications that are called PDE5 inhibitors, phosphodiesterase type 5 inhibitors. On the one hand, Viagra has been around since 1998. It's a long time now. But you know, one of the most interesting things for me about what you're working on is this interface of technology and sexuality, right? And what's it all going to mean for us, right? Like things are going to change, hard to predict. But you know, I was around and was actually on a scientific advisory board for Pfizer when Viagra was first released.
Oh, really?
1998.
I've learned so much about you from doing this.
And I also with Cialis 2 years later when that came about, and that was a new technology, but that technology was in the form of a pill, right? And there were a lot of discussions about what it would mean for humans, for human sexuality, for men and women. And as a matter of fact, not to shamelessly promote my own stuff, I wrote a book called The Viagra Myth.
It's a great title, by the way.
Thank you.
I knew about that book before I knew you. And I thought, you know, that's a pretty brilliant title.
Yeah. The surprising impact on love and relationships. And if you look here at the, I don't know how the camera can see that, but if you look here at the picture, it shows a pill of Viagra, sort of the blue, I don't know what you call it, it's kind of, it's oval-ish, together with little candies, you know, that you eat, like it says "Love Me Tender" and I Wonder and all these other things. And
who came up with that?
Whoever the graphic artist was for, or maybe the editor for the book. But I wrote that 5 years after Viagra had been out. Just when, you know, I had enough experience as a clinician with it, and to sort of hear what the experience was, and the psychological part of this was actually what interested me. And I thought we could just touch on that a little bit today with an eye towards how do new technologies impact human sexuality. And I think if Viagra and Cialis are good examples of this, the results can be reassuring. Because today we hardly think about the use of these pills, but it was a major thing.
You would be surprised how many people, I think, professionals like therapists, for example, and clients are concerned about using these medicines. Like, I think that urologists are probably feeling pretty comfortable with them and enjoy the safety profile, but I don't think that memo really got to everybody else. So some people really do worry. They worry about being dependent, not just emotionally dependent, physiologically dependent. You know, they do worry about how other people, how like their partner's going to perceive them. People are scared of them. So not dramatically, but more so than you would realize. So what's the myth? What's the Viagra myth here?
So the myth was really around the mythology of Viagra. So, you know, so the key is that some people were taking these pills in the hopes that it would improve their relationship. So for guys have a reputation, I think partly well-deserved, of sort of being penocentric, Like it's all
I
about
thought it was penile centric.
all about the equipment, right? So if a guy's having trouble in bed with his partner, and it's not going well, or even let's make it a more general comment: if the relationship isn't going well, the guy sometimes thinks it's because he's not doing well enough in bed.
And then he gets anxious, and then it can sort of like be a self-fulfilling prophecy when the anxiety takes over.
Yeah.
I feel bad for guys around this, because what you're talking about is his ability to become aroused, and that he then becomes super focused on his penis and whether or not he's aroused. The thing is, women don't have that same challenge. If a woman isn't aroused, she just gets lubrication and she can continue on if she wants to.
Right.
So, I think that probably if women had that same setback, if when she's not aroused they can't have sex, probably women would be more concerned about their own arousal than we hear about, I think.
Yeah, I'm so delighted that you, as a woman, have sympathy for us poor men. Because there's so much pressure on the guys,
There's
right?
so much pressure on a guy. Oh my God. What about that? You need to have sex in this exact amount of time.
Right.
It needs to be longer than
That's right.
this 3 minutes,
Yeah.
but it needs to be shorter than 20 minutes.
Right.
But some windows are much more specific than that.
Yeah.
That's a lot of pressure.
Yeah.
That's why it's Viagra. It's like,
Guys have so many. They worry about everything.
yeah.
They worry about the size of their penis. They worry if they're doing it right. They worry that they don't, especially younger guys, like they don't, or less experienced men. They don't know what the anatomy is.
Oh, for sure.
They don't know what they're supposed to be looking for.
Yeah.
Is there a G-spot in there? I know there's a G-spot in there. Is there a clitoris in there? I know there's supposed to be a clitoris in there somewhere. But guys don't know.
It's complicated.
And it's complicated.
Yeah.
And because this world appears to be so sexualized.
Mm-hmm.
The movies, the books, the videos.
Right,
Guys,
and if
they don't
they're-
feel like they match up.
If they're educating themselves with porn, which most of them are,
Yeah.
porn's not realistic for most people in so many ways.
Yeah.
So then they're not measuring
Right.
up for sure. Do you know, I just saw a statistic a little while ago that up to 30% of men aged under 40 have erectile dysfunction.
That's amazing.
It's amazing.
Yeah.
Up to 30%. Now, I don't know, like mild might still be considered
Yeah.
ED, right? So it's not just severe.
Yeah.
But nonetheless, that's a huge number.
That's a huge number. So the statistic we always bandied about in terms of organic or what might be considered physical cause of the erectile dysfunction, not just like you're nervous. The number that we always use is 52% of men between the ages of 40 and 70.
Uh-huh.
And that number comes from the Massachusetts Male Aging Study. It was based on a questionnaire. It was the first time that anybody went to a relatively healthy population and asked them, whether they were having trouble. There was some data from before from Kinsey, I'm sure, and Masters and Johnson had done stuff, but maybe Kinsey probably did the surveys. But anyway, 52%. But that's with a somewhat older crowd.
Uh-huh.
So for younger people to have that amount.
Right.
But if you take in all causes,
Yeah.
and like do you sometimes have trouble having an erection with a partner? The number can be huge, large. One of the most amazing things is that when in 1998, when these pills came out, the big discussion at the time was whether or not you should use or doctors should prescribe these medicines for men who had what we call psychogenic erectile dysfunction, where like a shy penis, or the guy has trouble with a new relationship. But, and we distinguish this by taking a history. We say if the guy can get a good erection on his own, then he doesn't have a physical problem. If he wakes up with a solid erection at night or in the morning, the plumbing is okay in the penis, right? And to me, it was obvious that these young men who were struggling, if I could help them, I was going to help them, and if that was the pill, that was fine.
So
But-
I love that approach, and I encourage that too in my practice, if I may interrupt you.
Great.
And that when I have a client who's got anxiety for whatever reason,
Yeah.
I encourage him to get, he doesn't have to get a lot, like particularly if he's worried about becoming
Oh my
like,
God,
addicted or whatever.
it's so important. It's so important.
Just get 6 pills from your GP
Yeah.
and just say your sex therapist suggested it, and that'll give you enough confidence to get over the hump. It
Absolutely.
works so often.
Yeah, it works great.
Yeah.
But the amazing thing is how many of my colleagues said, no way am I going to prescribe it on there. They thought we had to suffer
Oh,
when
that's
these
sad.
guys weren't around. These guys will get over it. They need to talk about it more. Why do they need to rush into sex so quickly anyway? But the truth is that a lot of relationships, if they happen around sex, on a first date or a second date
So
or a
that's-
third date, and if it doesn't work, a lot of those relationships aren't going to continue.
That's exactly right. They crash and burn. And it is not uncommon for guys to have difficulty the first time they're with a new partner.
Right.
So, yeah,
So why not?
that's what I say. So what about the dependency concern?
But that
everybody-
issue's gone now. So the issue, I think that there's, and now it's not only prescribed by urologists, but primary care
Right,
doctors.
and they're
do.
comfortable with it.
And even more, guys can even get these online now. Now you still have to go through, there's a gatekeeper that is a physician,
Uh-huh.
right? But you know, there are some countries, like you can go to, I think it's Mexico, and you can buy Viagra or Cialis over the counter.
Oh, wow.
The pharmacist can dispense it to you.
So what about if you get like headaches and stuff from this?
Yeah, so there are some side effects, and the side effects tend to be that are pretty common: headache, nasal congestion. Some people get flushing, where their face gets pink or red and their ears burn.
Oh, that's unfortunate.
Yeah, but that's really the worst of it.
Well, they say, what is this? You can't take them with nitrates or whatever. Is that
Yeah,
right?
there's that Jack Nicholson movie. What's it called? As Good as It Gets,
Oh,
maybe,
yeah.
with Diane Keaton.
Yeah.
And he doesn't, now it's an older couple, right? And he doesn't want to admit he has a heart attack or something like that, or chest pain. They get him to the emergency room, they're asking him his meds. And he doesn't want to admit to anybody
I
that
vaguely
he's
remember.
taking these. But the reason people ask is that nitroglycerin, which is often used to relieve chest pain from a cardiac source, you can't take the nitrates kind of medicine with these, or you can drop your blood pressure profoundly.
Oh,
Now, what's interesting is you don't hear about this so much anymore. I think the nitrates are in less frequent use. People who
Oh,
get chest pain
interesting.
often get angioplasty now.
oh, okay.
You know, so
Okay.
there's less of these nitrates around, but they still do exist.
So how do you feel about using these for a guy who's got premature ejaculation?
Yeah.
Because I have recommended that for multiple guys too, so that they not only are less worried if they ejaculate, because they can still, you know, they can still have an erection even if they ejaculate. So that sort of takes the anxiety away.
Well, I don't. Yeah. So listen, I think it's definitely it can be is in the armamentarium, as we say. Like, it's one of the
Yeah.
things that we use. Usually, even if you take Viagra or Cialis, you're going to lose your erection when you come. It can help you get a second
Yeah.
erections more
Yeah,
quickly,
okay,
so it
yeah.
can be useful that way. And some guys, especially if they're younger, can still maintain some firmness even after they have an orgasm. But a lot of people will lose their erection immediately with orgasm, whether they're taking these medicines or not. But it's certainly something useful, and a lot of premature ejaculation is built into, is triggered by anxiety also. So
Yeah.
in theory, if a guy is feeling like, oh, I'm the man now, you know, I've got this stuff on board, it's easier.
Yeah.
One of the things I was interested in, and again, I think some of this starts changing, is how men's self-esteem and their confidence as a sexual person is affected by needing to take a pill. And, you know, my own patients, I compare this to the use of testosterone. So if somebody has low testosterone, and you can get erectile dysfunction either because your blood vessels don't work as well, or because your hormone levels are low. There's a third reason, which is around nerves too, like after surgery for prostate cancer. But for the most part, unless you have that piece of that story in your medical history, it's either blood vessels or testosterone or psychological, right? Like basically anxiety. And when I would treat men with Viagra, the men still thought that they had ED. They were just managing it with the pills.
Mm-hmm.
Testosterone, if they got better, they no longer felt like they had ED. They were better. They were still on a medicine, but they thought of it somehow as more natural. I'm restoring my normal testosterone levels. They thought it better.
I see.
Now, one of the things, and I confess that I haven't pursued this, but a lot of Cialis is given daily.
Right.
It's a low-dose pill, 5 milligrams compared to the on-demand dose, which is 20 milligrams. But guys can take it daily, and then they don't need to take anything in anticipation of sex, right? Whereas Viagra or Stendra is the other one that's available now, similar drug. You have to plan it. You have to plan. Yeah, it works better if you take it on an empty stomach. So, if you go out for a meal, like one of the issues is the guy takes it before they go home and expecting to have sex when they come back. And some of the guys will say if they're not familiar with this and if they're sensitive to this issue, they don't absorb it as well with the food. And so the guys will say, well, I took it, but it didn't work. But doc, at 3 a.m. in the morning or when I woke up, I had a great erection. And what happened is that the absorption was delayed.
Yeah. Aww.
So anyway, so there's some planning that gets to be involved with the shorter acting medicines like Viagra and Stendra. They work quickly in some people, but not all. But with the daily tadalafil, daily Cialis, that's gone away. And I would expect that for some of the guys to no longer feel like they have ED.
Oh, I see.
Just because it's done away. They take it like a vitamin.
Right. How do you feel about recreational use? Like, do you worry about that?
Well, if you're asking me personally, but I think it's fine. It turns out, these are some of the safest medicines that have ever been studied.
Really?
Yeah, when they first came out, there was a concern about heart attacks. That's
and
totally
vision or something. Wasn't there a vision thing?
Totally bogus. There was a vision concern, again, relatively early. This thing called NION. It's abbreviated NAION. Non-arteritic ischemic optic neuropathy or something like that. But it's not associated with this. There was an ophthalmologist who had ended up with a series of, 15 patients or so that he published, all of whom developed this eye condition where they had decreased vision. They don't go completely blind. It's usually in one eye, and it's usually decreased. Not that that's good.
Yeah.
It's terrible. But, and the common point for all these patients was that they had taken Viagra or Cialis.
Oh, my.
But it was already a common drug. And the risk factors for having a vascular cause of erectile dysfunction are the same as the risk factors for this NION eye condition. So was it the pill or was it the underlying conditions? And when they've looked in large studies now at, tens of thousands of men who have taken these pills, there's no increase in that eye condition.
Oh, my gosh. So this is one of those myths that doesn't die in medicine.
Yeah.
Because this concept is still going around enough that I'm well aware of it.
Yeah, and it may even show up in the product labels around this stuff.
Yeah.
I think hearing loss was in there too, but these are rare cases, and their connection, whether they're causal, whether they actually cause these problems, I think is highly dubious.
Okay, so then I saw something recently online, like in Medscape or something like that, that was suggesting that this could be a healthy daily medicine for people because of the improvement in blood flow in the body.
I think it is. I think it's good for blood vessels. No question.
For women too?
Good question. So if it's good for blood vessels in men, presumably it's good for blood vessels in women. Viagra in women is a whole other topic.
Yeah.
And Pfizer, which made billions of dollars off of this drug early on, was very interested in women. But women are more complicated than men.
We are complicated.
And it turns out that women weren't necessarily, they didn't have more satisfying sexual encounters. They didn't have necessarily easier orgasms. But arousal for a woman, the equivalent for men when they get an erection, is actually having more blood flow down there, which has two parts. For the clitoris, it can get fuller and it doesn't quite become necessarily as rigid as an erection, but it can come close. And the other is lubrication. So it turns out that lubrication, what actually happens in a woman in the vagina, is increased blood flow gets filtered and kind of transformed into this fluid that comes out. If you don't have the blood flow, you're not going to get the lubrication.
So why aren't they using Viagra then for a part of an approach for menopausal women?
So I don't, that's a great question. So menopausal women may have additional issues, which they don't have the hormones. Like, I think that without the hormones, I don't think that you may not get much, even with increased blood flow. But there may be a role for Viagra. So Pfizer abandoned its studies in women. But in terms of just pure lubrication, is there a role for it? I know women and female investigators in this area who have tried it on themselves, and they said, yeah, they thought it helped them. But Viagra didn't pursue it.
Drug companies get a bad rap around abandoning research in women, and I just want to comment on that, because I think what people might be sort of thinking is, oh, women are getting a bad rap, they didn't care. And I feel like I want to say to people that if there's money there, the drug company is going to pursue it. And they simply felt that the reactions for women were too, I don't know, but I can tell you that it's very logical. They thought the reactions for women weren't consistent enough that it was really going to sell much, so there wasn't any money for them. So it's not that anybody is against women having a good sex life. It's just the bottom line for a drug company is $1. Isn't that?
Yeah, I think that's true. And so I think that for the drug companies, it is purely a business decision.
Yeah.
But part of what can influence that business decision is whether they think the FDA in the United States is open to approving a drug. And the FDA has behaved a little mysteriously, is one word to use about women and drugs. There is a female Viagra, or what's called female Viagra. It's not Viagra. It's called, the drug is flibanserin, and it's sold under the brand name Addyi, Addyi, and I think you have some experience with that.
Yes, I do. Yeah.
But with that drug, but that's got approved, and that actually helps women. It's now indicated in women who are premenopausal, so they don't have hormone issues, presumably, and have lost their sex drive.
Yeah, so I was on the FDA panel to help approve that.
Yeah.
And I tried hard to make sure that got through.
Yeah.
We'll have to do a talk on it at some point.
Yeah. So that drug exists.
Yeah.
And what's interesting about that drug for men, I'm talking now as a male specialist, is that one of the most difficult things that we treat or try to treat in male sexual problems is delayed orgasm. These guys can have trouble or anejaculation. And these guys are unhappy. At the beginning of this talk, you were talking about poor guys. They have to fit their sex and their orgasm into a certain time frame, right? So too quick isn't good. We call that premature ejaculation.
Yeah.
But some guys are struggling to finish.
Yeah.
And it's frustrating for them. It's frustrating for their partner. Things start chafing. It's not a good thing all around. The guys become self-conscious that it's taking so long, which makes it even harder. So we often use drugs, that are totally not only off-label, but never intended for this, right? There's a drug called cabergoline. There's people use Oxytocin. You often have to go to compounding pharmacies to get these things. You won't get them at Walgreens or CVS. But it turned out that with the original studies before the pharmaceutical company, which was Boehringer Ingelheim, when they took this, eventually got through approval with a company called Sprout. But the original studies included men, and men responded well to these, but they made a decision to go after women for an indication. But off-label use of flibanserin for men with delayed orgasm actually works pretty well.
Well, that is fascinating. We're going to have to do more on that.
Yeah. So, here we go. Viagra's been around forever. It's fun to talk about it. And it's been great talking to you, Dr. Brandon.
You too, Dr. Morgentaler. I always learn from you, and I did again today.
Great. So for those of you watching, if you like this material, please subscribe, give us a good review.
Yeah.
And we hope to see you again at one of our next podcasts.
That's right.
Thank you for listening to The Sex Doctors. with Dr. Marianne Brandon and Dr. Abraham Morgentaler. Be sure to subscribe, leave a review, and tune in next time for more expert advice on sexual health and relationships.
I believe in miracles. Where you from? You sexy thing, you. I believe in miracles. Since you came along.